but just because we have a short amount of time, I wanted to start off by introducing Bill. For a lot of people, he doesn't need an introduction, but just to give you a little bit of background, it's with great pleasure that I introduce Bill. I feel very, very lucky to have met Bill and to know Bill. It doesn't take long when you meet Bill to see that he's just one of the, he embodies loving kindness and warmth and compassion. You know, there's a bit of a joke where, I mean, his clients all tell us this, but some of the therapists here at our center also would like to see Bill for therapy because they just, you know, just being around him makes people feel better. He's also one of the most present people that you will meet. We're very lucky to have him here as a colleague as well as a therapist on our team. So just a little bit of background on Bill. He provides emotion-focused therapy for individuals and couples, as well as emotion-focused mindfulness therapy for individuals and groups. And you'll be hearing about that today from him. He developed emotion-focused mindfulness therapy, adapting mindfulness-based interventions to facilitate deeper experiencing, to help people process and address their core issues, to help them connect to their body's inner wisdom, and to help them cultivate growth and flourishing. Bill also does research on emotion-focused mindfulness therapy. He's also the mindfulness and wellness clinical educator in the health, arts, and humanities program at the University of Toronto here. Bill's also a pioneer in providing mindfulness training in Toronto. It always amazes me how many people Bill knows. He trained and mentored mental health professionals, psychiatry residents, social work students in mindfulness-based approaches for over 15 years. Many mindfulness-based clinicians in Ontario received their initial training through the mindfulness-based group practice program that Bill has co-led at the University of Toronto. And he continues to provide professional training and mentoring in emotion-focused mindfulness therapy. He's worked as a mental health clinician in psychiatry at Mount Sinai Hospital, where he provided individual psychotherapy in the clinic for HIV-related concerns for over 22 years, as well as emotion-focused mindfulness groups for HIV-positive gay men for psychiatric outpatients. In addition, he's provided emotion-focused mindfulness wellness training for employees at various hospitals. Bill was also awarded the Joel Sadavoy Community Mental Health Award in 2007 by his department for outstanding contributions as a co-principal investigator of a community-based hospital knowledge exchange program, in which frontline workers and volunteers in age service organizations were trained and supported to provide brief narrative, art, or mindfulness interventions. And he also received the Karen McGibbon Award of Excellence and Seymour Schulach Honorarium. And at this point, I would like to turn it over to Bill. Oh, and actually just before that, before I turn it over to you, Bill, I wanted to mention that there'll be an opportunity towards the end of the workshop where Bill will ask you a bit about your experience during the intervention. And while we have Carmine Malfitano here, who I'm just gonna actually, who's gonna be helping us out with questions. So if you have questions during the workshop, Carmine will be reviewing them and trying to put them forward towards the end, okay? And we won't be able to respond to questions during the first part of the workshop, but we will during the second part of the workshop.
And Serene, just wanted to mention that the questions can be typed in the chat. You will see a Q&A button at the bottom of the screen, and you can type your questions throughout. I will collect the most common questions and offer them to Bill.
Okay, thank you, Carmine. Okay, and at this point, I will hand you over to the very capable hands of Bill.
Thanks very much, Serene. Thanks very much. I'll just share the PowerPoint. So it's a deep pleasure to be here with you all to share something so close to my heart. Really, this exploration of how can we help ourselves and our clients to cope with all the challenges in our world today. And here specifically exploring how to integrate deeper therapeutic processes into mindfulness meditation. So I'm going to be giving you an overview of emotion-focused mindfulness therapy, and then demonstrating to you how we set up the meditation and the journaling in in our groups, in our EFMT groups, and then we'll be meditating for 10 to 15 minutes together in silence, and then journaling for 5 minutes, and then there'll be an opportunity for you to just share a few words or a sentence or two about what that experience was like, and I'll look through the Q&A option, all of what you've shared there in the chat, and then reflect on your experience in the meditation. And then at the end, as Serene was saying and Carmine was saying, there'll be an opportunity to answer questions. And so I ask that when you share your experience, to just start with EXP, so I know to focus on those for looking for the experience. And when you share a question, start with a Q. And if you don't remember, it's not the end of the world, but that would help us sort it out at our end. So emotion-focused mindfulness therapy integrates mindfulness-based interventions into emotion-focused therapy, as Serene was saying, to expand how mindfulness can enhance emotional intelligence, and then to help people be able to address inner conflicts. This is where a part of ourself is beating up another part, or scaring, or where we're suppressing, a part of us is suppressing emotions, and as well to address unfinished business conflicts, struggles that we might have with people in our current life or earlier in life. And also to help people make better sense of situations and their lives, and to cultivate healing, growth, and flourishing. And it's interesting, mindfulness sets up optimal conditions for doing this kind of deeper work, therapeutic work, but it doesn't actually specify or encourage it. It needs to be adapted in order to be able to open and be able to enter into these kinds of deeper processes. Mindfulness-based interventions, the grandmother of them all is mindfulness-based stress reduction, and then it got integrated into cognitive therapy to address vulnerabilities for depression relapse. And it's been adapted for a lot of other conditions as well, and basically focuses on training people in mindfulness meditation. And these are typically 8-week groups with 2 to 3 hour weekly sessions and a 1-day retreat. And in the case of mindfulness-based cognitive therapy groups, they typically have 8 people in them. And then mindfulness-based stress reduction groups are more like classrooms, and there might be 20 or more people in those groups. This approach to meditation's been adapted from Buddhist sources, and most of the research has been done on mixed medical populations and cancer patients, and it's helpful for symptoms of anxiety and depression. So the heart of it, what's it about? It's about developing mindful experiencing. And the idea is that we spend, we spend so much time up in our heads, a long way cut off from our emotion, or over immersed in and fused with difficult emotions and thoughts and driven by them. And the idea is mindful experiencing is this other opportunity to learn to settle into our body and to come alive to the implicit feel of the present moment in a way that becomes increasingly grounded and spacious and friendly. And that makes it more possible for us when difficult thoughts and emotions come into our experience, to be able to turn towards them and to be able to acknowledge them and accept them and to decenter from them. So decentering means being able to see that they're not direct truths about self, other, and world, and to be able to approach difficult experience in a way that disembeds us from them, and to develop some distance from them, to disidentify, to see that they're just events in consciousness. And that helps to lower the emotional reactivity, and then lets people be able to let go of the difficult experience and let it float away on the proverbial stream of our experience. And then to reorient to present moment experiencing, which could be in meditation, focusing on the breath, or doing a body scan, or perhaps just going with a more open awareness relating to our experience. That's a very powerful capacity to develop, very helpful. However, it has certain limitations, and the heart of it is some emotions are just difficult to let go. And for example, I was getting dressed. It was about 12 years ago. I was getting dressed for my dad's funeral, and I was in a hotel room. I don't wear a suit too often, and I started getting really anxious about, did the colors match? And I thought I'd sit down and meditate and just let go of this. And I just kept getting more and more anxious. And so instead of trying to acknowledge and decenter and let go, I got into the worry and the anxiety, allowed myself to worry, allowed myself more to feel anxious, and started to develop a deeper feel for what was on board. And I found myself dropping into grief, into a real sadness, realizing how much I miss my dad and how much sense that made. I was going to his funeral. And as I acknowledged that, the worry about the clothing just blew away. And as I allowed myself to feel sad, and that really told me what was important here about going to the funeral, about relating, grieving my father, relating to my friends and family with love, and to be able to give his eulogy in a confident, kind way. And so that's an example of a helpful primary emotion. So typically, like that anxiety about the clothing, those are secondary emotions that we can get so caught up in. And what I dropped into was a more core primary emotion that was helpful, that was giving me a lot of information about the situation. And these helpful primary adaptive emotions, they tend to be mild to moderate, they come and they go, and they orient us to situations. They have a lot of implicit helpful information, tell us what matter to us, and motivate us to act. Now, it could have been, my mother had died 2 years before, and I might have dropped into feeling like an orphan in a storm, alone in a threatening world, in a big, scary, threatening world. And in that case, that would have obviously not have helped me go to the cathedral and give the eulogy. But emotion-focused therapy provides ways of being able to, often it's finding these big emotions that can be so paralyzing are often modes we were conditioned into earlier in life. And it might be helpful to find that memory, spend some time where that emotion actually makes more sense, and then get a sense of the unmet needs. And that can evoke helpful emotions like compassion or sadness towards the young person we were then, or anger towards people who harmed us. And that then transforms the unhelpful emotion and frees us to be able to make more sense of our past and to be able to be free to experience more helpful emotions in the present. So maybe I'll just pause and acknowledge there's many people here in the workshop right now who are well aware of emotion-focused therapy or experienced therapists. And then there's also people who this is new for them. And so in this workshop, I'm gonna be trying to provide something for all of you, hopefully. But this kind of deeper processing, while it's familiar to many of you, for many people, it's not familiar. And a big reason has to do with, many of us growing up, our parents didn't know how to calm themselves down, let alone how to calm us down. And they didn't know how to look inside and identify what they're feeling and express it in helpful ways, let alone how to coach us in how to do that. And so, when kids, just that, let alone more, even more serious forms of neglect or abuse, if we can pull it off, we learn how to tighten our muscles and hold our breath and come up into our head and try to figure it out and hold the emotions down and push forward. And this is very much how the modern world rolls, right? We're all up in our heads, rewarded for that, holding our feelings down and trying to trying to push forward. There's a couple things lost with that, of course. And one is the way we end up divorced then from the way our body is resonating with the situations we're in, has all this helpful information telling us what matters to us in situations and orienting us to act. And then up here in the head, we're left vulnerable to these secondary emotions that obscure our more core helpful feelings, and that are based so much on trying to figure it out. So worrying, what if this happens? Well, then I could do that, but then that might happen. And the worry and the anxiety can just spin out of control, or ruminating. What's wrong with me? Why are people so mean? When will this ever end? And finding ourselves spiraling down into depression, or getting critical towards ourselves and angry towards ourselves, or getting caught in destructive forms of anger, of rejecting anger and contempt. Now, these kinds of emotions, these secondary processes of emotion and thought and bodily experience, mindfulness-based interventions emphasize on acknowledging and decentering and letting go of these kinds of secondary emotions. And again, very powerful, very helpful, but there's times when it's important to be able to do deeper processing. And that's what I was trying to figure out in working in this clinic for HIV-related concerns with people living with HIV. And we had done a randomized controlled trial of mindfulness for gay men living with HIV, and we were able to publish it. By the way, all the references are on my website in the bibliography. I'll post it again at the bottom, the link for it. So we got some good results, but I could see that we really needed to be able to help people better deal with issues like high levels of internalized stigma, harsh self-criticism, and adverse childhood events and trauma in childhood that are prevalent for so many people, and especially in this case for gay men living with HIV. And I explored integrating different approaches to try to bring self-compassion more deeply into mindfulness, different forms of self-compassion, acceptance and commitment therapy, emotional alchemy, which is an integration of schema therapy, and mindfulness-based stress reduction. And it was all really interesting and wonderful, but all of them emphasize this emphasis on acknowledging and decentering from really what are secondary emotions and letting go of them. And if people are getting caught in deeper, darker emotions, how do you help them then, other than just validating that it's rough, right? And so, that's the ground from which emotion-focused mindfulness therapy emerged. So now I'd like to explain to you why I think emotion-focused therapy is well suited to adapting mindfulness for this kind of deeper work. And first of all, it has a special focus on how to enhance the therapeutic relationship to create safety and optimal conditions for this kind of deeper therapeutic work. And this involves helping therapists learn how to really develop interrelated factors key in developing genuine therapeutic relationships, such as responsive, communicative empathy, where the therapist is very much staying in touch with the client and listening to their process and helping to reflect back in a way that helps them deepen their experience and arrive at these core primary emotions. And how deeply interrelated empathy and compassion and positive regard and congruence are. Congruence is where therapists are able to have a better sense of what's actually going down, what's happening in our primary emotions. So we're more able to be fully present and whole when we're relating to our clients, and we're not, say, smiling, but our eyes are cold. We have a better sense of what's on board. So the other area where emotion-focused therapy brings such strengths is its research and the way it's specified different therapeutic processes emotion tasks, and as well as markers that heighten therapists' attunement for being able to recognize opportunities for doing specific kinds of therapeutic work. So tasks would include things like empathic exploration, where a therapist is following, a client who's describing something of importance to them and reflecting what they're hearing back to them in a way that helps them be able to deepen their experience. Or experiential focusing, where someone might have a global vague feeling about something, and the therapist can help them turn their attention inwards and come alive to that feeling, allow it to become richer and fuller, and to be able to reflect on it, so that they're able to deepen their experiencing of it and really get a sense of what it's implying and to carry that forward. Or there's processes like chair work that really help to evoke emotion in people and help them be able to process and work through those inner conflicts or the unfinished business. And all of this, what's at the heart of it is helping people be able to arrive at primary emotions and get a sense of, is the emotion helpful? If it is, helping them to reflect on it and make sense of it, or is it unhelpful? And if in that case, helping them transform it. So there's a considerable body of EFT research now, of process and outcome research with issues such as depression or complex trauma, and promising research trends and eating disorders and different kinds of anxiety, as well as emotion-focused couple therapy being the most researched and effective of marital therapies. So the format of emotion-focused mindfulness therapy group, it can be presented in group or in individual therapy. Back when we were seeing people in groups before COVID, we were doing a 1-hour individual intake, and then there'd be 8 to 12 weekly sessions. Different programs had different lengths of 2.5-hour weekly sessions, and then a half or a full day retreat, and followed by monthly 2.5-hour continuation sessions. And we're going to be starting an online group here at the Center for Psychology and Emotional Health. We'll be doing some group intro sessions for the public, open to the public, in November and December. And then there'll be individual intake sessions with clients, and then 8 2.5-hour weekly sessions. And then, towards the end of that, asking the group if they'd like to continue for another 8 sessions. And when the group ends, we'll be offering 2.5-hour continuation sessions. So this will be for people who are in Ontario, and anyone who's interested, they can contact our center at that email, and I'll have that at the end of the presentation as well. So we don't have any published research on this yet, but we're writing up a feasibility study that my colleagues Rod Lemwisco and Cleo Haber carried out in family medicine at Mount Sinai here in Toronto. At baseline, there were 74 people, and at post 2-month follow-up, 35. The primary objective was to increase self-compassion, and the secondary objective was to decrease depression, anxiety, shame, and to increase overall functioning. And what we found at the end of at post 2-month measures was an increase in self-compassion and in the various subscales in Christine Neff's self-compassion scale, and decreases in anxiety, depression, and negative affect. And clients were invited to write some comments about how the group had been for them, and there were emerging themes around how much they appreciated learning to be able to identify emotions and different kinds of emotions, how helpful that was, how the approach helped them to not feel alone with difficult thoughts and emotions, and how the group felt like a safe space. And that's something that's really struck me in these groups, bringing in these kinds of very deep, intense emotional processes and how it actually deepens the sense of safety in the group. And then also how much people appreciated the therapists, their compassion for whatever people were bringing up in the group, the compassion and the empathy, and how that helped them develop compassion for themselves and for others. So they were focusing there on compassion rather than, they weren't actually mentioning empathy, but you can hear how it's interrelated. So the heart of, I think when I explain this, a lot of people have a hard time understanding what's actually going on in the group. And the first session, you know, there's typical setting up a group, introducing it, reminding people about the boundaries, people, you know, an opportunity for people to introduce themselves. And then the rest of that session is the format for all the other sessions. And basically we're meditating and then journaling, and then clients take turns sharing their experience, and the therapist listening to what they're saying and then joining with them to help them deepen their experiencing. And you know, to be able to process that out. So that process there then is the structure of all the other sessions. They start with meditation, then people journal, and then clients take turns sharing their experience. And when someone's sharing their experience, the therapist listens to the whole meditation narrative. So this is something that's kind of different about EFMT compared to EFT, is that when the person's sharing their experience, they might describe some difficult experience, but we want to get a sense of the whole process in the meditation, how it unfolded. Because in the meditation, they may have worked out of that difficult experience and emotions, and they might now, that might have been so 35 minutes ago, and now they're in a deep state of calm. So we're trying to get a sense of the whole process and really valuing that process that they went through. And then the therapist's response to whatever seems most alive and poignant or salient in the moment. And this quotation's from Les Greenberg. It's one of the DVDs. I love it. He talks about EFT being oceans of empathy and islands of work. And you know, it really highlights how the importance here, where therapists are following the client's emotional experience and reflecting what they're hearing back in a way that helps them deepen their experiencing, using responsive, communicative empathy and empathic reflections. You know, so someone's, you know, talking about how worried they are at work, and you know, that came up in the meditation and the journaling, and how alone they're feeling, and what they're mainly feeling is worry and anxiety. But the therapist noticed they're starting to choke here, and there's tears appearing, and the therapist, you know, joining with them says, I don't know, but it seems like something might be so sad in this for you. And then the person suddenly finds themselves crying. And that sequence you see a lot, meditating, journaling, and then when the person's sharing in a safe situation, it's easier for these deeper emotions to come up. And with the person crying, they might be discovering, actually, you know, I'm missing my family in New Brunswick so much. And then the therapist is able, you know, to help them explore that and make sense of that feeling. Over the course of the group, we get into deeper kinds of processing around, you know, traumatic experience or inner conflicts as the group develops more trust. And so people are learning new processes in this kind of interaction. And so when a client does something that's fresh or particularly intense or novel, then the therapist will debrief with them afterwards, and then debrief with the group, because there's a lot of vicarious learning going on as people see people do this deeper emotional work. They themselves are moved. And I was amazed to find how the group turns into a little tribe here. Everybody's got each other's back. And then there's a lot of learning going on at the same time. So we're discussing what people experienced. And then the therapist provides some brief psychoeducation on here's what you saw, and here's how you can integrate that into your meditation and into your life. Oh, so here's our moment of humor. Are you not thinking what I'm not thinking? I wish I could hear some laughter, you know, it'd be, anyway. But so here's where I'm gonna set up the meditation now. So emotion-focused mindfulness therapy basically involves settling into the body. So giving yourself some time to just let yourself experience your body and coming alive to the body and feelings in ways that are non-judgmental and self-compassion. And I'll be talking more about self-compassion in a moment. We're basically cultivating gentleness and curiosity towards whatever states emerge, even sleepiness. And, rather than trying to snap out of the sleepiness, letting yourself feel sleepy and to be with it. And in order to really come alive to feelings, it's going to be important to allow yourself to think, to be able to reflect on the past, to be able to think about the future. Anything that's part of our human experiencing is welcome in this form of meditation. You might be seeing images and colors. So this meditation is going to be silent. And this was an interesting thing to learn, how there's a deeper there's a place for guided meditation, but in these longer forms, there's a gentleness and a compassion to just letting people go where they're going to go, rather than having them need to listen to you when you don't even know what they're experiencing. And here I'm not so much trying to criticize other forms, but just try to sell you on, this is something to explore. It's really worth trying. Silent meditation where no one else is trying to guide you. And there's a gentleness that comes out with that. So I'll talk a moment about self-compassion. So Christine Neff has developed a robust self-compassion scale. And she says there's three key components to self-compassion. So the first one is, say you've had a really rough day, or you've made some kind of mistake. It can feel like just the thing to do to beat yourself up. That'll be really helpful. And of course, it's not. It clouds up our mind. It makes it harder to think. And so the first thing is to try to be kind to yourself, just to try to be kind to yourself. And, it is when we're beating ourselves up this way, we can feel so alone with whatever we're struggling with. And so to take a moment to remember our common humanity, that whatever you're struggling with, many, many other people are struggling with the same thing. And that what we share isn't some kind of exercise in perfection. It's these existential challenges and limitations and making mistakes that we share. And I can feel the sadness at how hard we all are towards ourselves in this, and the need for more kindness here, and self-acceptance. And the more we can let ourselves in on this, the more we can let our friends and family and colleagues and clients, in on it as well. And life can get a little easier. And then mindfulness. The temptation when we're beating ourselves up is to try to jump back into hyper-confidence mode or hyper-confident meditator mode, but instead giving yourself a moment to soften and actually notice the struggle that's on board and how you feel in your body. What are your emotions? What are you feeling? And what kinds of thoughts are you getting caught up in? Let yourself notice that and try to relate to it with some kindness. And I'll be coming back to how to integrate this more into meditation in a couple of slides. So you could start off either just by coming into your body and opening into whatever's on board and exploring that. Or if you like, you could start by focusing your attention on wherever you're feeling the breath, the air moving in your body, or your chest or your belly rising and falling as you breathe, or the sounds in the room you're in, or sensing the contact of your body with the chair or your feet with the floor, or whatever your hands are touching. These are all nice things to focus on. But in this style of meditation, you're not being asked to hold your attention there. Wherever your attention goes, you're welcome to go with it and find out more about it. It's like a lot of us, we've got parts of ourselves tugging on us, and we're saying, be quiet, I'm giving this webinar right now, instead of turning around. And here's this opportunity in the meditation, instead of trying to just let it go and come back to the breath, to turn and to relate to that part of you and say, yeah, what's happening? And that part of you is going to go, oh my God, he's listening. You know, so to actually be able to turn to the different parts of us and to actually develop a deeper sense of what's happening in the meditation at that point. Now you might find yourself doing a to-do list, and you could let yourself do that, or planning out your day, or worrying, or reflecting on a relationship, or maybe thoughts fall away and you're floating in vague feeling tones, or following imagery and associated feelings, or you're with tensions in your body. And you could let yourself do that. Let yourself go with the state you find yourself in, rather than trying to switch it up to some other state. Could also, it can be helpful to notice the various dimensions that are part of your experience, you know, thoughts, feelings, sensations, motivations, or images that might be happening. Helpful to stay in touch with the body. So in the meditation, helpful to find a posture you can maintain for a while, but if you feel uncomfortable, feel free to move. And you know, you could sit in a chair or sit on a cushion or lie on a mat on the floor or lie on a bed, whatever is comfortable. And then if it starts to feel uncomfortable, feel free to change the posture. So now there's going to be lots of people already familiar with meditation, you know, and you're welcome to do the form of meditation you're already familiar with. In fact, you're probably going to find yourself doing it anyway, and so you're welcome to do it. And then there's this invitation to loosen up around the instructions, and to let yourself go, and see what else is happening sometimes. If you do start beating yourself up in the meditation, for example, criticizing yourself for not meditating properly, or what the hell did Bill ask us to do, and beating yourself up for that, you could try to remember to be self-compassionate. And a way to bring self-compassion more deeply into mindfulness, it's a lot of people feel when they're meditating that if they were doing it right, they would just be feeling calm and spacious and grounded. And if they're in a struggle or there's some kind of conflict or pain present, it must mean they're doing it wrong. And there are styles of meditation that have that perspective, but this isn't one of them. And there's other styles that also agree that a major function of meditation is to allow difficult experience, to allow suffering to emerge, so we can develop a different kind of relationship with it. So we can learn to embrace it, and in order to develop a more authentic relationship with our life and to live a more fulfilling life, and so that suffering becomes more workable. And so ways of doing that, or bringing self-compassion in, is if you do find yourself struggling or beating yourself up, or you could try to be kind to yourself, and to remember that if you're struggling in meditation, it's not evidence that you're a bad meditator or that you're not meditating. It's evidence you're having a human experience in meditation, and actually a potentially useful one. And so you could let yourself have that experience. You're having the kind of experience humans have when they meditate. And then, you know, let that struggle become a meditation experience. Take some time to notice what's happening in you in that struggle, how it feels in your body, what are you feeling, and what's happening in your thoughts, what are you struggling with, and to try to bring some kindness to that. Now, if this was neutral and this is some emotional arousal, you can hear that we're valuing bringing some emotional arousal into meditation, but it's important that it's in a window of tolerance, that it feels workable. If it starts to scale up and become too intense, then it's important to calm. And you know, ways of doing this often involve bringing something pleasant or neutral into the foreground of your awareness and letting everything else fall to the background. This tends to calm, but you know, nothing works perfectly all the time. But this will tend to calm and soothe. And there's all kinds of things you could focus on: your breath, those feelings of contact of your body with the chair or your feet with the floor, any area of the body that feels pleasant or neutral. You could try saying soothing, calm phrases, maybe putting a friendly hand on your chest, or you could visualize yourself in a safe place, or that you're with someone who cares about you, or maybe if you have a dog, you could imagine you're with your dog loves you and knows you're fabulous, right? So, and just staying with that until you find yourself back into a more workable form. And then you can decide maybe you want to continue with that, or maybe you want to open it up again and see what else is happening. Now, dissociation, that's where we feel numb or unreal or out of the body or spacey. And again, if this is neutral and there's that emotional arousal and there it's scaling up, feeling overwhelming. Dissociation is a way of feeling overwhelmed, but we're shutting down. And so trying to calm out of dissociation might not work so well. What can be more helpful is to gently stimulate your senses and to invite yourself to come back into your body. You could try opening your eyes, looking around the room, bringing in the colors and forms. You could really feel your body in the chair, your feet on the floor, the way it's supporting you. Again, inviting yourself down into your body. And did you hear how my voice lowered there? It's just a nice thing to do anyway. And then once you are feeling more grounded, you could, if you want, open it up again or do some calming practice. The other thing is don't feel trapped in the meditation. If it's too much, feel free to stand up and go make yourself a cup of tea or go for a walk and then come back and rejoin us. So it's important not to feel trapped in this. So afterwards, we're going to journal. So this is, now one of the artifacts of setting this meditation up at the beginning is people can get anxious about trying to remember everything so they can journal it. And just understand that that's kind of what can happen for people, you know, when they're learning how to do this. But really, it's not that important that you remember what you remember. A lot of us, you might only just remember what was happening at the end. So then write that down, you know, what you were thinking or feeling. It's helpful to write it down in as much detail as you can. Metaphors can be helpful to use differentiated language rather than broad labels. You know, a lot of meditation people are going like thinking, or feeling. And here we'd like to know what you were thinking about and what were the feelings? Were you sad? Were you angry? What was it feeling like in the body? You know, try to get a sense of the general themes of your thoughts and feelings and how these themes shifted in the sitting. So, you know, a lot of meditators, they only remember the peaks or the valleys of the meditation, and journaling is a way for us to be able to actually remember what happened, more details, develop more intimacy for, you know, our inner landscape, for what actually happened in the meditation. It's amazing the things we can suddenly remember. Oh yeah, that happened, and we would have completely forgotten. And then this provides a deeper ground for us to be able to share our experience after the meditation. So yeah. So now we're gonna shift into to meditation. Here's contact information, my email. Here's, you know, if anyone's interested in the online group or referring people, there's the contact, there's the references, and you could photograph that if you want. We'll come back to it. And just to say again, so we're going to meditate for 10 or 15 minutes. Then we'll journal for 5. I'm going to ring the bells at the beginning of the meditation, ring the bells at the end, and then we'll journal for 5 minutes. And then it'd be helpful if you'd like to share your meditation experience, a few words, a sentence or two, and maybe start that with EXP for experience, EXP, so we know that that's the experience part. And then, you know, any questions you're having, you could put that in the chat under Q, and we'll address that after we address the experience. So I'll give you a chance then to, maybe I'll leave that up while we're meditating. And So I'm going to ring the bells, and we'll meditate for about 12 minutes or so, 12 or 13 minutes, and then we'll journal. So here goes, here comes the bells. Oh, I should just mention then, I don't know if I mentioned it, but so again, you can find any posture that you're comfortable with. I think I meant not to mention around the eyes. You can close your eyes, you can half close them and unfocus them, or some people meditate with their eyes open. The advantage of closing them or half closing them is it helps to turn inwards, but whatever fits best for you. Okay, so here we go. Okay, so we'll take 5 minutes just to jot down notes, or if you'd prefer to sketch, you could do that, but to jot down notes about whatever you recall happened in the meditation.
Bill, you're muted.
Thanks, Serene. Getting used to the webinar world. Okay, so if you'd like to share some words or a couple of sentences about the experience you just had, I'd love to see it and respond and to your experience. So here's an experience. With the third bell to start, felt vibration tingling through the body and awareness of heartbeat and breath, and listened to that, and they slowed. Had sensation of warmth flowing into hands and feet. Sat with that and was aware of holding tension in neck and shoulders. So did gentle stretches to move and release. Very nice. I like the way you're responding to the experience, going with it. And Serene and Carmine, have you been looking at the questions, or should I just go through them?
Yeah, I can read a few to you.
Okay, great. That'd be super. Yeah.
And we're going to do our best, but we have like over 60 questions. So we're
Okay.
Yep. I'm gonna maybe focus more on questions related to what the topic of today instead of going to more general questions to EFT. But maybe the first one, I think you spoke to it during when you discussed the experience, but maybe a few words on this, Bill. What do you mean by coming alive to the body and feelings in a non-judgmental way? Can you provide an example, please?
Yeah. Well, so, I gave you the example, I hope you don't mind if I'll return to the example that I gave because it's already there with my dad's funeral and getting anxious about the clothing and did it match um, uh, and so actually, first of all, our body coming alive into the body, our body is where all this information is, the way it's tightening, the way it's resonating, and we tend to avoid it by just not feeling what's happening in the body. So just helpful to acknowledge what's happening in the body. And so the question was how to be with it in a non-judgmental way, Carmine. And so we're full. It's like we've got this little guy behind the eyes who's already knows things and is already judging it, and it's got what your analyst told you, and it's got a formula. And it's like putting all that aside and actually allowing yourself to settle into your feelings and try to get more of a sense of it. And this mindfulness, you can do some of that, but there's a tendency to put aside the content of it as well. And so there I let myself worry. I let myself feel anxious, but I also let myself feel my body and spent time with it without judging it, without saying, don't worry, don't be anxious, it's a waste of time. I mean, I already knew that, letting go of that, letting myself be with it, and then also trying to expand into more of a sense of the body. And what started to emerge then was the deeper resonances of the feeling and being able to drop then into the sadness. So maybe I'll stop there. It's such a big question. But.
Other questions, Bill, were about clients who might benefit from this intervention. And one person is talking about clients who have already difficulty self-regulating, and self-regulations might be the goal of the full therapy. Or
Yes.
Other people were talking about clients with who have experienced traumatic events or low self-awareness, less distress tolerance, and people are wondering if there needs to be to filter out people beforehand, or
Yes,
if you decide who joins the group.
Great question, and I kind of intended to actually address that, but so I'm glad it was raised. So important for standard mindfulness-based interventions, and important for this one as well. That you need to assess, is a person in a place in their life where coming into difficult emotions is going to be helpful. And so if they're caught, first of all, if they're caught in self-destructive forms of coping, like addictions or high levels of suicidality, or if there's high levels of dissociation, all of these are counterindications. Then when the person's talking about the whole issue is emotional regulation, there's, if you think about people in phase line, phase 1 borderline personality disorder, they're not in a place to spend, dialectical behavior therapy focuses on 2 or 3 minute guided meditations. And so you wouldn't take someone who's that dysregulated into these longer meditations. Either they're guided or not guided, because it would be too triggering and re-traumatizing. And then also you need to sense, can the person actually, is perhaps the issue with a lot of the cluster B issues, people are having difficulty actually connecting with, turning their bodily experience into an emotion by symbolizing them, and symbolizing, the physical experience, and allowing to, being able to experience it as an emotion. And if that's the issue itself, then again, you'd be asking people to do something they can't. And there's a kind of a gray zone there where I've had people with, who are struggling with some borderline personality traits or some serious degree of narcissism, but not extreme. And so they might actually, the person who's struggling with the borderline issues, they might be focusing more on calming and gaining some knowledge in watching people do the other kinds of deeper processing. Or I think of clients who've had some struggles with narcissism, and they learned how to soften those defenses and open a bit, but they weren't actually able to do the deeper processing. But they still valued their involvement in the group. So it's really, there's an area where you're using your clinical judgment. Yeah.
And Bill, I have actually a few more very interesting questions that are coming up, but maybe one that is coming from a lot of people is, will the PowerPoint and recording be available of this session, but also if there's additional training available and how to access it?
Yes, great. Well, I'm delighted people would like that. And yes, the answer is yes. We'll send out, I guess Serene will send out the PowerPoint, or maybe we can leave it somewhere for people to pick up. Whatever works best.
You can also
go ahead.
Post it on the website, which is we
yeah.
can post the recording and the PowerPoint on the website, which is www.cpeh.ca.
Great. So you'll be able to get it there. So the answer is yes. And then Serena and I are going to be training people in emotion-focused mindfulness therapy next year, perhaps in the spring or summer. It'll be 3 weekend workshops with an optional 6-month training afterwards of monthly sessions. So looking forward to that. And we started thinking about other things too, maybe one-day workshops. So we'll be thinking about that. So glad people are interested.
I don't know if I'm aware of the time. We have 3 minutes to the end. Do you want to take another question, Bill, or move maybe to wrapping up?
Oh, maybe should we take another question?
Sure. Maybe there's a lot of very interesting questions. I'll send them to you afterwards. This person says, how do you make use of this technique in individual therapy or in an online format? Is that possible? And
okay, yeah. Well, so what I would do the same way if the person has the resources like that they do in mindfulness-based cognitive therapy, where you extend the individual session a bit to allow for some more meditation. So to actually meditate with the client would be optimal. Now, some clients really have are already meditating regularly, so that may not be as important, but it is helpful to meditate with people and to reinforce that weekly to help them develop the meditation practice. So if you had a bit of longer session, like an hour and a quarter, an hour and a half, you could meditate together, journal together, and then hear what the person's experience was, and then join with them and process that. Now I do have a client who's a very disciplined meditator, and we have normal 1 hour therapy hours, and it's not as important then.
yeah, I think we're right at the time.
We're out of time. Well, so thank you everybody for coming. It's been wonderful for me to have a chance to share this with you. So delighted, and look forward to having opportunities to to meet, hopefully meeting lots of you either in trainings or EFT conferences. So glad to have had this chance to share with you. Thank you for coming.
And I'm sorry we weren't able to answer all the very interesting and wonderful questions, but I want to thank you, Bill, for also providing a space for us therapists just to have a few moments to, check inward and deepen our experience, which I can speak personally, we don't often have a time to do, given that we're helping others all the time. Thank you.
My pleasure, and it is important for us to have that time. Yeah. Thanks very much. Bye-bye.
Take care, everyone. Be well.